In fulfillment of his administration's commitment to bring quality healthcare services closer to the people, particularly during emergency situations, Governor Akinwunmi Ambode commissioned 20 mobile intensive care unit ambulances and 26 transport ambulances. Let's see the ceremony.
Within the premises of the Lagos House, Ikeja, Governor Akinwunmi Ambode was accompanied by his deputy, Mrs. Oluronti Adebule, senior members of the Lagos State Civil Service, and some first-class traditional rulers to commission 46 mobile ambulances recently acquired by the state government.
To the glory of God and the usage of humanity, for us to use all these ambulances to save lives and protect the citizens, I do commission it to the glory of God.
The fleet comprises 26 transport ambulances and 20 mobile intensive care units to enhance the state emergency ambulance services. The commissioning of the ambulances is in fulfillment of Governor Akinwunmi Ambode's campaign promise to implement people-oriented programs.
In my inaugural address, I pledged my total commitment to run a government that will leave no one behind. A government that will implement programs that will make life simpler, easier, and happier for our people. Today, we are launching the free ambulance service as a demonstration of our commitment to that pledge. This is also in consonance with this administration's mantra of running a government of continuity with improvement. I recall with much satisfaction the great strides we have witnessed in the health sector in the last 16 years, commencing from the foundational leaps of Asiwaju Bola Ahmed Tinubu to the landmarks of Babatunde Raji Fashola SAN.
He said the new mobile ambulances will further widen the coverage and increase response time of the state ambulance service, especially in rural areas.
The idea of this free ambulance service is born out of our desire to bring quality health service closer to our people, particularly those in emergency situations or conditions. We are commencing this service firstly with 26 transport ambulances, which will be stationed at our 26 general hospitals within the state for easy access. In addition to this, we have restructured the state emergency ambulance services and increased the fleet of our new mobile intensive care units by 20, bringing the total number to 33 mobile intensive care units. This will widen the coverage of our services beyond the metropolis to the hinterlands within the state. In total, we are launching 46 new ambulances today. What this ambulance service does is that it's toll-free, and beyond accident victims, anybody can call on 112 24/7 so that this thing can be of free service to all our citizens. We have invested a lot of efforts in improving the health sector in our state. The objective of this program is to give community health back to our people through a primary health care service that works every hour of the day and every day of the week. All our general hospitals will now have new mobile X-ray machines to reduce the cost of patients doing X-ray outside the hospitals. Additional equipment are on the way.
Governor Ambode further reveals plans to improve healthcare delivery through the program.
Other components of this program, which we have set in motion, include the upgrading of the infrastructure, the facilities, and services of the Ekpe, Badagry, Ikorodu, Alimosho, and Bagada General Hospitals, as well as Lekki and Amuwo Odofin Maternal and Child Centers to international standard. The development of a Lagos State Medical Park to deliver world-class medical services as well as promote medical tourism is part of what we are doing. We're also establishing an effective and efficient health insurance program as provided for by the Lagos State Health Scheme Law. Approval has been given for the recruitment of more paramedic staff and special medical coordinators to ensure 24/7 service to the citizens.
The acquisition of the Mobile Intensive Care Unit was the fallout of a stakeholders meeting with the governor, at which deliberations focused around immediate challenges faced in the health sector.
Critical issues impacting on the health of residents, especially in the area of access, has been taken on and frontally addressed. These include access to pre-hospital emergency care at the community level, access to critical care for our soon-to-be and new mothers, timely access to safe blood and blood products, and even access to qualitative care in terms of diagnostics, utilities, and referrals, all of which are determinants of health outcomes. I am confident, therefore, that this show of goodwill by government will be reciprocated by all the health professional associations moving forward.
Initially, we were moving from general hospitals all over the state. And in improving our response time, we were asked to locate to accident-prone areas. And with that, we still think we need the community to feel the impact of the health service in the state. And this has brought about the establishing more ambulance points within the community so that they will have access to this ambulance service. So the prognosis will be very good. And we want to use this opportunity to thank the governor of Lagos State for upgrading Lasambos to this level.
This ambulance we have here today, some of us have been trying to get it for our centers 2 years, 3 years. And when he promised that all these things will be done, we believed him, and we are indeed very happy that this is being actualized today.
The ambulances have been distributed to hospitals and medical centers across the state and will be deployed free for Lagosians. By this development, the state government again reiterates its resolve that Lagos will continue to be a front runner in the provision of quality healthcare in Nigeria. Governor Akinwunmi Ambode also handed over 10 new Toyota Hilux security patrol vehicles and 15 motorbikes to the State Police Command. Some of the vehicles were donated by Elizade Motors Nigeria Limited to support the state government in its effort to provide adequate security and safety of lives and property.